Yes.
Okay. When I started with OHSU, they had certainly done quite a bit of work to try to scope their work queues to be as efficient as possible, and making sure that everything that came into their workflow actually needed authorization work and or benefit review. So I really feel like we had gotten to a place where we could be as efficient as we could utilizing our system. So the next step that we were looking for was, how can we reduce some of these manual touches? How do we make it so that we're not having redundant workflows? We're not having folks spend time on things that really we could automate. It's the same thing over and over again. It's data entry. Our team is spending a lot of time taking, the information that was in our system and putting it into another system for the insurances to review. So I think at this point, we've done a lot of work with the VALER team to try to customize a tool that helps our team to be as efficient as possible. There's a lot less clicking, there's less data entry errors, there are, I think overall, we're seeing increased productivity. We're seeing folks, kind of, not only are we getting this increased productivity, but we have some front-end users that are willing to give a lot more feedback because they're seeing that they have an engaged team from the VALER side that, if we have an issue or we have an idea, the engineers are very excited and involved and come up with what they think might be, beneficial to our team. So it's really a collaborative effort. So that's what I see now and what we're doing. But certainly,
no, I would absolutely agree with what Ryan said. Our team, I think, for once has somebody that's listening to them and hearing what would work for them, and then taking that and implementing a fix to their problem. Before we had however many portals that we were going out to, and of these big companies, these big insurance companies, and very rarely did they ever get to voice their opinion on what was a barrier for them or what was working for them. And now there's somebody on the other end that's helping them streamline their process and be able to give that feedback. If this isn't working for me, this is working for me. Can you do this? Can you fix this? And I think it, like Ryan said, has empowered them to voice what they need in a workflow or what they need in a tool to be able to do their job.
We definitely did our homework. One of the tasks that I was given when I first came on to OHSU was identifying a vendor for automation, since again they had done a lot of work scoping our work queues. We did meet with quite a few vendors. Everybody's got wonderful products out there, ideas on what's going to work well for your team. And I will say each one of them had some really cool pieces. But really what it came down to is, what is the best for our team? What do the payers look like on our side? What do we want to have? Ultimately, what's our end goal? Do we think that this vendor will get us there? Are they willing to work with us on the challenges that we're facing as a facility? Because what we're seeing on our end with our payers might not be the same that somebody over in another state is facing with their insurers. So what it really came down to is, who is willing to truly collaborate with us? Some of these bigger vendors, again, had a wonderful tool, a lot of bells and whistles, but it didn't fit. It might fit only 30% of our payers. Or hey, it does this piece, but it doesn't do this piece. It doesn't integrate with your EMR. It doesn't, it doesn't push back into this. It's still data entry here. So for me, it came down to, for what we're going to pay for it, what's going to be our ROI? Like, do we have a team that's willing to answer the questions I have? I don't want a one size fits all. I want somebody that's willing to hear our pain points and be able to work with us to find some type of solution. When we first started the process, I mean, there were a few things that stopped us from getting off the ground. Of course, we enter into a partnership right as, COVID's happening, and the world is a lot different, trying to get things set up remotely and work with a team, in a virtual world that you haven't done before. So we had that. For me, it was the first time, kind of working through a process with contracting and trying to get that off the ground. Oh, hey, there's this piece. And then also bringing in IT to say, guess what? We thought we were going to do something this way. Now we need to bring additional stakeholders to the table. So when we talk about just getting things off the ground, there was that. But then when we finally started moving, I think it wasn't so much bottleneck, but there was, it was new to our team to be able to say, hey, this doesn't work for me. It was an awkward feeling
Yes.
for our team to not get the response
Yes.
that it's working as designed. So I think we had some reluctancy even from our front end users and from our subject matter experts to voice their opinions. But I think, again, the fact, as Joe has stated and that I have mentioned, we've really empowered them to tell us what needs to happen and what you need to do your job efficiently. I think it was tough to start, but I think they've got a good grip on it now.
Might have a hard time bottling them
Yeah,
up.
I don't know if you can bottle that back.
Which is
They have a hard
fantastic.
time going backwards.
Yeah, so I'll kind of speak to that one. I think, from the beginning, there's always a little bit of a learning curve. Just anytime you introduce a new software or a new platform for them, I feel like we have a really strong, very smart group of individuals who, pick things up really quickly. So as far as I would say, like the training aspect and getting them, kind of knowledgeable on how to use the tool, if they picked it up really fast, I would say, what they had a challenge more so than anything was just how it was like a one-stop shop. So, it was hard for them to kind of wrap their brain around the fact that they can do multiple payers in one spot, and they're going to see the same screenshots, the same clinical questions, the same responses that they would normally see when they went to a portal. So I think, I had a few different meetings with my team, and, we were going over things before we went live. And I think the biggest barrier for them was just not understanding how that was something that was possible. How, they're still going to be able to do the exact same work, see the exact same information, the exact same screens, everything that they see now, but they're not going to 6, 10, 12 different portals to submit an authorization.
Yeah, and on top of that, I'll note, so I do think, even for myself, jumping in and being able to navigate, it's pretty intuitive, it's pretty user-friendly. But on top of that, our team was able to provide input on what organically felt appropriate for where things were placed. Does it make sense that it comes back like this? Hey, what would you want that wording to be? Does that resonate with you? Do you understand what this is? Do you think other users would understand what this is? And I can say that even recently, some of our new hires, I think we get them trained pretty darn quickly.
Yes.
And again, the fact that we're able to train them on one tool and not have to train them, hey, when you go to this website, this is what it's going to look like. When you go to this website, this is where you put that information. And by the way, this one, you never put that information in. So, we've been able to work with the VALER team to really build it to the specifications of what our team sees and feels is appropriate.
I would say the positive downside to VALER is that now when we have new staff members, we're teaching them in VALER how to do these authorizations. So if they ever have to go to a portal and do it themselves, they're a little bit lost because VALER is, so awesome for them to be able to use that then when they have to go to a portal, they're just a bit lost on kind of what they need to do from there. So, we get our staff trained up real quick on VALER and they're able to use that, and it's so efficient for them, and they like it so much that then if for any reason they have to go out to a portal,
what do you mean I gotta check
it takes them a little bit longer, or they're like, what manual? I have to do what manually? How do I do that? So yes, absolutely. So it's great that we have that problem. Like, when I hear that feedback for the team, like, I don't go to this portal very often. It looks completely different from the last time I logged in directly to it. Like, I love hearing that because I'm like, good, that means you're not having to go to that portal. And that's what I want. Yeah, I really feel like it has helped us be able to really streamline processes for our staff. Every time we are able to work with the VALER team to implement a new solution to a problem that we've identified, or put in just another piece of automation, and it's one less thing for the team to have to do. I feel like it gets them to be excited about being able to work through more authorizations because they're able to recognize that they're not getting bogged down in meaningless tasks, a lot of data entry. So, when we've implemented different things, bulk submit, SAM, when we updated our fax workflow, so they're not, trying to do something in VALER and also in our Outlook inboxes and stuff like that. I hear all the time from my team, this is amazing, this is great, I don't have to do this extra thing. I am not having to spend my time, typing in information. I'm not having to spend my time going to look for something and then, making a note and then just to go back in the next day and do it all over again. They're really seeing that, that what VALER is doing for them is really letting them focus on what we want them to focus on, which is getting those authorizations out the door. Yes, and they're feeling like the work that they're doing now is more impactful than just
more value
transposing information from a website to our EHR.
And I think even further on that, now more than ever, staff feel like they're not getting to everything. Like you said, the burnout, that there's so much happening in healthcare. There's so many changes that have come their way. And so I really think at the end of the day, somebody being able to look at everything they've been able to accomplish, they feel like they've been successful in their role. I can honestly say that I've had a conversation with staff members in the past where, it's overwhelming to come into so much work and feel like you're working so hard and you just don't make a dent. You're still in the same place at the end of the day because patients aren't going to stop coming. Insurances aren't going to stop making new policies. Yeah. There's not going to be any, no one's going to make it easier in the healthcare world, from payers to get, to get authorizations. So really what it needs to be is how do we, as the employer, as the manager, as the innovative IT world, like how do we make it easier for the end user to accomplish what the insurance companies are putting in as barriers? So,
and I also think that VALER, using the VALER tool has given them more transparency in their own work, because they can go in and see specifically the authorizations that they've submitted, and they can quickly see the outcome. Even if they submit it now and it pegged, in a day or two, they can go back in there and be like, oh, I was worried about that one. It's now approved, so it's easy for them to see the outcomes of the authorizations they're submitting, without having to track it some other way, or, going through a list of a whole bunch of patients from, that everybody on their team worked. They're able just to take a quick glance at VALER and they really see that it's there for them. It's in their face. They're able to get that, I guess that instant gratification of, I got that completed. I was worried about it. That's one less patient I have to worry about now because the authorization's in place. I can see it. I know what's good to go. I don't have to worry about it for the next 2 or 3 days until, I'm able to follow up on it again. And I think that says a lot because, we all want to know that we're being successful, and, just having that right there for them to see, I think has, just made their lives a lot better because they don't have to worry anymore. I think it's taking that worry out of what happened after I was done with it, what happened after that. Because they may never see it again. But with VALER, it's easy for them to see it again. Yeah. So they know.
Yeah, so that was really fun recently, pulling some numbers. I love to see, okay, well, we feel that it's happened. Now let's validate what's happened. And I'll speak specifically to our diagnostic specialty, in reviewing their productivity. We have a standard, 45 a day that we expect our team to touch and work through. And when we recently pulled our numbers, we saw that our average was actually 54 a day that our team is now working through. So an increase of 9 per day. And, if you take that across our 8 people working on those, it ended up being 300 and some odd, I think, a week additional that we're touching and we're working through. And so, that is more than an FTE worth of work just on that team being able to submit for authorizations. And you think of how many more patients they're able to touch and work through, and how much further out we're able to process authorization requests and getting people access to their providers or to their tests or whatever services they're looking to have. That's a big deal to patients that are obviously either in pain or nervous about a situation and, waiting for results on something. So that was pretty impressive. I think seeing, just what we're able to do bulk submission on or touch once, now we can actually see reporting that shows us we touch 1,100 of these a month once and never have to do anything on them again because it gets authorized and gets pushed back into our system. We don't have to go out and check whether or not it's pending. We don't have to document the same thing that's in a portal somewhere into the EMR anymore. So we're seeing increased results there. And then actually one of our heavy hitters are you're always going to have the top of the road. You're going to have people who, not hitting all of their productivity standards, but we have one individual that on average they're actually now processing 68 a day. Again, going from 45 to 68 on average. In 1 month, that person did 77 on average a day. So again, when you talk about empowering an employee, you can empower these folks that are already wonderful, great employees, working as hard as they can, but it just shows you when you give them a tool that can make their work streamlined or more efficient, it's going to benefit you, it's going to benefit your patients, and it makes a big deal.
And even outside of their individual productivity, we're seeing it in, how our lead times, before VALER, our lead time was 5 days.
I think we started at 4 days.
4 or 5 days.
5,
yeah.
Then we got to 7.
7 was we were excited when we hit 7.
We were
like, yes. I think last week when we were looking at it, we were at 13.
Yeah.
So, instead of processing an authorization just a couple of days before a patient is, now we have almost a 2-week lead time, which is amazing for, the cases that need to go to a higher level of review at the insurance company, or that end up coming back and needing a peer-to-peer with the ordering physician or whatnot. And it gives that ordering physician a week and a half extra to be able to get that peer-to-peer scheduled and have that conversation with the insurance company. Yep.
Maybe even, if a patient ends up needing a different type of procedure in lieu of what's been ordered, it gives them an opportunity to reorder and then have that conversation with the patient. It gives us opportunity to have financial conversations, so it makes the financial experience better for all of our patients, to understand, price transparency. And then actually I remember the last time I pulled numbers, it was months ago, but we had seen an increase of about 11% in our, our diagnostic orders, and we haven't increased our staffing. So that's pretty cool.
Yeah, absolutely. And I mean, just on a, not a, as like a able to show numbers kind of way, but just in general, and we can attest to this, we are getting far less worrisome emails from providers who are like, hey, I ordered this test and you guys submit an authorization and we're a day away, and now I need to do a peer-to-peer review with a physician. I'm in clinic all day, like.
It's nothing like a Monday morning angry provider call or email.
Yes.
So having less, or none of those coming through.
It's definitely relieved, I think, the stress off of the providers who are, now they're getting that lead time, which, in turn has relieved stress off of us having to, apologize and try to work with them on, how do we make this?
How do we improve process?
Yes. How do we streamline this?
Yeah.
And so, I mean, there's very much tangible results, but there's also, results that we're seeing that, I can't pull a report and show you, but we just
feel it.
Yes, exactly.
No, VALER has not given me a toughness authorization yet. No.
Well, that's the other question we have. What does the future hold?
I'll dive into this one. So actually, you did a reference call a few weeks ago and was asked this exact same question. And thinking back over the last 2 years of our relationship with VALER, I can honestly say I cannot think of a situation where we have asked for something and VALER has told us we can't do that for you. Things take time. There's definitely been things that we've asked for that VALER's like, that's going to take us a little bit.
Let me give you an expected date.
Yes, let us work on that. But I can't think of anything over the last 2 years that VALER has told me no, that we can't do that, unless it has been something that we've been restricted or constricted from either the payer side or the Epic side or the connection in between, but nothing on VALER's end that VALER's been like, we can't do that for you. There's just no way.
Yeah, and I will say what's been pretty awesome, so we meet with the team on a regular basis, daily, just for 15-minute call to say how are things working. If we need to cancel leave, we will. But I think having that direct communication, knowing the person on the other end, knowing them by first name, they know who we are. They know that we're going to be a pain and continue to ask about things. No, but I will say that even when it's something like, hey, we can't do this, but what if we did something like this? Would this work for your team? Do you like this? And, our team members have said, no, I don't like that, on something. And they said, okay, well, what would be better? Would you like it to look this way? And so I will say there's been nothing that, the team has said, we're not going to be able to deliver on that. We're not going to be able to do that for you. It's been, let's see what we can do next.
Yes.
And how we can try to accommodate your request.
Yeah, I would say that, VALER is definitely, if we're asking for something that, might be a bit challenging or might be tough or whatnot, they will come back and be like, we might not be able to do it exactly the way you want it. Here's alternatives for you. And so far, all those alternatives have worked out for us perfectly. When we've been like, okay, let's go with this alternative, it's still worked out. It's still gotten us to the point that that we wanted to get to, just with a little bit of a different
learned new tech terms.
Absolutely.
They told us, hey, we can move this here and do this, and I've learned more tech jargon in the past 2 years than I never thought possible.
Yes, and I think what we can, at least in my mind, what we can equate that to from Valor's end is they understand that, especially for us, patients come first, right? So we're not talking to, a company who has never had any patient care, who's never had to, deal with a patient that, they've had to tell, hey, like, we don't have this.
Patient.
Yeah, we don't have this authorization in place where as a company, Valor is very much the exact same mindset that we are, that patients come first. And them getting that care is what is number one. So when we come up with an ask, even if it's something that is completely out of left field or something like that, they're going to do everything they can to either make that happen for us or make something happen for us that's going to satisfy our need. And I think that really comes from they understand what our priorities are as an organization, and they align their priorities with our priorities.
Since we've talked about this before, I think.
Oh, yes. The end goal and final vision, I think, that we shared years ago when we started down this path has always been getting to a touchless authorization. And I do believe it's going to happen. I'm telling you, we get closer and closer. Technology is allowing for more advancements in this, in this section of healthcare. I think, the fact that we've identified, hey, when an order drops, we could send you this information immediately and potentially never have that hit our work queues. Just go straight there, get it authorized, have it pushed back, drop in, status has changed. So again, allowing our team to work in an exception-based environment where they're really working on the things that they should be, those challenges that they need to, more price transparency, making sure that patients are aware of what their benefits allow them. There's so many other things we could spend our time doing. It's frustrating to think that we have very able, knowledgeable individuals spending their time doing data entry or requesting something that we know a patient should be approved for is going to need. So in that case, let's have them spend their expertise or, put their expertise to use. But I think that's our future.
And I think that, between the knowledge and the feedback that our teams can provide and the exceptional engineers at Valor and that take our crazy out of this world idea or our requests and turn it into reality, I really think that we are going to be able to accomplish, that goal of having a touchless authorization. We, I think, present a vision to Valor, and, the super smart engineers that, constantly are using terms that I'm just like, you're going to need to dumb that down for me because I don't know what you're talking about. They are able to take whatever wild idea we have and make it a reality. So I think the sky's the limit.
Someday we're going to be #touchless off.
Someday soon. That is Kathy's goal.
Yes. I think that's, again, you talk about we have an aligned goal. That's what we're looking to do. And everything we've done, it's been a lot of work. It's been a lot of hours, a lot of work from both sides, a lot of understanding, how things work inside and out. I think I learned things that I'm like, what, we do that? So I think it's been a lot of passion put into it. And I think, when you have a vendor in a company that has that same drive and that same goal, absolutely.
I think that's what's driven our success, right? Because we have that same goal, we have that same passion. So
it's there's a super team.
Yeah, there's not conflicting interests, So we're able to work collectively to get to that goal because we have the same goal. I also think that all of the work and all of the time that we have spent making this into what it is, both from our side as well as the Valor side, it almost feels effortless. like we, you know, like there's been a lot of hard work that has gone into it, you know, to get us to where we're at, but it almost feels effortless.
Like the conversations that you're having with
well, yeah, exactly. And that has happened a bunch of different times where we'll make just a passing comment, and then the next thing we know, you know, Kathy comes back or one of the engineers comes back and they're like, hey, you made a comment about this like 2 weeks ago. Here it is for you, you know, and it won't even be necessarily like
so it's easy to us because we're not doing any of the coding stuff. We're not building anything in the background.
Definitely.
Again, wicked magic just happens. Yes. You throw it out there and they're like, hey, look what we have for you.
Yes, absolutely. But it just feels so natural and just so effortless because there's not hoops. There's not red tape. Right? We make a request, you know, VALER is like, let us ponder it. Let us look into that. Let us see what we can do. And then they come back with, you know, what they can do and how we can do it and whatnot. But it's not endless back and forth of like, well, you know, we can do that. We can't do that. We can do this. You know, it's really like we request it. You know, VALER looks at it, works on it, proposes 2 or 3 or 4 options of what can happen. You know, we are like, hey, this is what sounds best. You know, VALER gives us some, you know, kind of builds it out and shows us how it'll work. We rubber stamp it. They build it. It comes to fruition, and it just seems effortless. Like there's never been anything that has been hard or frustrating as far as like,
I don't know, putting together some of that payer information is pretty hard.
But that was on our
How many layers do we have?
Oh, yeah. But it just feels so effortless. Like, you know, it feels like you know, almost like walking into your, you know, a team member's office or your supervisor's office and then like, hey, I need this. And it's just like, yes, go. You know what I mean?
Well, let's make it happen.
Yes, absolutely. And that's always VALER's answer. Let's make it happen. We don't know how we're going to make it happen yet. Like, well, you know, that we need to work on, but we will make it happen. And they always come through for us in one way or another.
Awesome. We pride ourselves on that, having been in your shoes.
That's what I'm saying. I think it's amazing. You know, when I was talking about the super team, you throw a provider in the mix, some front end users, and then, you know, a techie team, and you get yourself one heck of a
and the wicked
team.
Magic.
Yeah.
The wicked magic of the engineers.
They are.
An extremely, extremely talented group of engineers by far.
And you're definitely blessed, and nothing happens without the feedback and the constant idea generation. So that's all part of it. It's how we like to work, and it's been a super special working kind of collaboration. So we're super excited about working with you all.
Yeah, definitely. And I've had conversations with Kathy about the engineers. You know, then I'm just like, wow, your engineers are amazing in their, you know, their responses to the team, and that's a great idea. That's fantastic. Let's look at, you know, like just the
or hey, this happened. I don't know what went wrong, and they're like, well, let me take a look.
Yeah.
And it's not one of those I send a message or a ticket out into the world and have no idea who's touching it and where it goes. It's one of those instant, I have this, let me look into it. In the meantime, do X, Y, and Z until we can figure it out.
And that definitely threw our team off in the very beginning like, when they would be working and VALER reached out to us about an error that happened. Like that
we saw this on our end.
Yeah, hey, we saw this failed for you, or we saw this happen for you. Do you need help? Do you want us to try it again? Like we looked into it. And it was mind blowing that, you know, the technical piece of it was reaching out to us to be like, hey, there was an error. We're working on it. You know, give us a little bit. Like I've never experienced the proactivity that I get from VALER. You know, it's not, well, we're going to just, you know, sit back and wait until you escalate something to us. We see it. We're going to let you know we see it. And then we're going to, like, take care of it for you. It threw my team for a loop for so many months. They're just like, I don't understand how they know what is going on, like, instantly.
Yes, exactly. And so I think that, and, you know, when people ask about the difference, you know, I've worked with the big box vendors. And, you know, some, like I said, some of them have some great products that we currently use. And I really appreciate the wonderful work that they've done on some of those pieces. But for me, I've also felt that frustration of feeling like I wasn't important enough. And, you know, I was kind of in the myth, I was kind of in a black hole where I would voice my, you know, my disapproval on something or my frustrations, and they would fall on deaf ears, or like I couldn't get any response, or like I said, when I get a response, I will never forget, it's working as designed, and your design didn't work for me very well. So I think, you know, just when we talk about collaboration, I truly appreciate having a partner.
Yeah.
Not just doesn't feel like it's your vendor. It feels like it is a partner, because if I'm not successful, then you don't feel successful.
And in those instances where it is working as designed, and it is, you know, something
then
that
redesign it.
but Valor specifically, you know, if Valor is working as designed, but it's something, you know, on our end that we input wrong or did something like that, you're not made to feel like you're doing something wrong or this is working as designed, figure it out. It's very much like, you know, this is actually the way it's set up to do, but I think this is what your problem is. And, you know, the team is very great about, we'll jump on a call with you. We will, you know, we'll walk you through it. We see what your problem is or where you may be going wrong with it. And they're willing to help us understand that. It's not the, you know, the just like automated response of, yeah, this is how it works. Like what we have is perfectly working fine. Sorry, I don't know what to tell you.
It's working on our end.
Yeah, exactly. It's very much of a interesting that didn't work. Like, let's figure out what's going on, and then, you know, if it's something on our end, helping us understand what we did, what we missed, where that break in the process was, and then we don't have that again. You know, we were able to fix it on our end and move on. Definitely a partnership. Like, there's no better word for it. It's definitely a partnership instead of a vendor relationship. It's very much, we're in this together. Let's get it right together.
Yeah, we very much see it the same way, right? It's the only way to really get work done.
Yeah, absolutely.
So.